Hey there, this is Dr. Evan Osar, developer of the Integrative Movement Specialist Certification. Welcome to this edition of Fitness Insider, where we're going to talk about posture and helping our clients that have chronic postural dysfunction. A lot of our clients are dealing with chronic tightnesses and muscle imbalances and even muscle weaknesses related to their postural strategy. One of the most common things we see with our clients, especially clients that work out, is that thoracolumbar hinge. And Sarah's going to go into that thoracolumbar hinge, and what that is where clients are hyperextending from the thoracolumbar junction. Oftentimes we think it's an increase in lumbar lordosis, but it's actually an increase at the thoracolumbar junction because they're hinged and gripped up at that thoracolumbar region. And this is how they're loading their exercise patterns with and basically living their life. The problem with this postural strategy is even though it may look good from the side, relatively speaking, versus a slump posture, what it's doing is over-compressing the low back. It creates a compensatory lumbar spine flexion and posterior pelvic tilt, and then it locks up the ability to stabilize and breathe. It locks up the ability to use the diaphragm, the psoas, the transverse abdominis, the QL, where all these muscles blend in to this area of the low back. So I'm going to show you how we easily cue our clients out of that, and then how we monitor to make sure our clients can maintain this posture through a functional pattern. So we use a squat pattern in this video. So Sarah, I want you to kind of come along with my postural cues, and what I'm going to do is lightly palpate with permission, palpate her lateral rib cage. Sarah, I want you to think about being longer through the TL junction. So what I mean by longer is creating space in your TL junction, and I'm going to gently give her just a gentle traction up towards the ceiling. I'm not really lifting her, just a gentle cueing towards the ceiling so that she elongates out of this area. And if you can touch your clients, no problem. Just do it on yourself so they can see what you're asking them to do. So now that Sarah's longer through this area, I'm going to have her take a couple deep breaths into that low back and lateral portion of her rib cage because I want her to be able to use the diaphragm. So breathe into my fingers so I can feel her expanding out laterally as well as posteriorly through that thoracolumbar junction. And again, if you can't touch your clients, no problem. Just observe it or have them feel it on themselves. So now that Sarah's got a better ability to be long and understands where that position is, now we're going to have her do a squat pattern maintaining this alignment. So Sarah, what I want you to do is put one hand on your rib cage, or on your chest I should say, and one hand on your abdomen. And I want you to keep the distance between your hands as you squat. I'm going to place my hands on your lower rib cage so I can monitor to make sure that you stay nice and long through this area. Think about a string being from the top of your head pulling you gently towards the ceiling, okay? So now, I want you to squat, sit back into your hips. So I'm going to monitor this area, the thoracolumbar junction, make sure she stays long as well as being connected through her rib cage and her pelvis. Come back out of that position. Perfect. Sit back into your squat. Good. And then come back up. Now just spread your feet out so we can do like more of a normal squat. Same thing again. Sit back in the hips. Stay connected through my fingers here. Perfect. Stay nice and long through the back of your spine. Let's do one more repetition, just like that. Perfect. Come back up. And then slowly drop your hands to your sides. Stay nice and long. And this is where I want you to stand, and this is where I want you to sit as you sit in your chair at your desk. Okay? So again, a very easy cue and a great way to teach your client through their functional exercise patterns where a more neutral alignment is, where a more optimal position is for the spine. It will help them decompress and elongate through their spine. They'll feel less tension, less tightness, less gripping through their body. And this is how you really can create powerful postural changes with very little effort. You don't have to stretch and tug and pull and squeeze and get people to brace and do 30 minutes of myofascial release. You have to teach them where optimal alignment is, help them get there, cue them into it, and then make sure you reinforce that through your functional exercise patterns. I hope this video helped you, help make you the expert that your clients need, want, and will pay for. This is Dr. Evan Osar with Fitness Insider. Thanks for watching. Have a great day.